Good afternoon, ASC Care Network. This is another family discussion, this time with clinical leaders from within our organization. I'll start off by asking them to introduce themselves and their position. And let's start with you, Jeremiah.
My name is Jeremiah Haynes. I'm an LPN with Swissville Nursing and Rehab in Vevey, Indiana.
Sierra.
Hi, I'm Sierra Williams. I work at Danville Regional Rehab, and I'm the Memory Care Support Specialist and also a CNA.
Awesome. And then Katie.
My name is Katie Lake. I'm the Director of Nursing Services at Valparaiso Care and Rehabilitation Center.
Well, thank you, everybody. For those listening, this is unscripted. We're just going from the heart. And today we want to talk about just a few questions: why we got vaccinated, what's keeping us up at night, and then why we're asking our peers, not just here at American Senior Communities, but across the country, to prayerfully consider a personal choice that is really near and dear to every individual, for it involves putting something in our bodies. So let's start with this, because I'm talking to clinical leaders. And I'll start off by saying, what keeps you up at night in regards to this pandemic? And let's start with Sierra.
Hi, I wanted to talk about why I got vaccinated and how COVID affected our building here. COVID affected our building before we were able to get vaccinated, and we were in shutdown mode. No one could leave, no one could come and visit. We pretty much had to take away their rights to be able to visit families, see families, and that brought a sadness upon everyone here. So we had to be the people to provide that for our residents. I got vaccinated because I saw it firsthand, what COVID did to our residents in our more susceptible community here. Even the after effects, the pneumonia, we lost quite a few of our residents, and their families weren't even be able to come in and see them and visit them in their last final moments because of the illness that it brought. So I got vaccinated to protect my people, and just so that we could have kind of like a herd immunity, and I did it to protect.
Okay.
Yeah.
Okay. And so in the spirit of keeping this thing organic, let's go. Jeremiah, why did you get vaccinated?
Yes, sir. So, I'm pretty new to being a nurse. Actually, I'm a 2-year nurse. I finished nursing school in 2019, and surprise, a pandemic hit the world, and it's been nothing short of challenging. But even with the challenges, there have been surprising blessings. I know that sounds crazy, but just follow me for a second here. This time last year, our building, like so many, were locked down. We had COVID positive patients. And the weird blessing of it, we've only had that status for 1 month, November of last year. So we've been tremendously blessed. The loss and things that we saw, heartbreaking though it was, a tremendous blessing that's been what we've seen so far. That being said, in those most trying moments, the blessings that I saw, you talked about each of us being clinical leaders. I saw CNAs step up as leaders. I saw nurses step up as leaders, because the truth is, titles don't make a leader, actions make a leader. And I've seen men and women both step up into roles where perhaps they just hadn't been activated into yet, and then were able to walk in those roles. In that time when we had active cases in the building, I had COVID myself. So having COVID, caring for COVID patients was probably the single most difficult thing I've ever done. They can teach you stuff in nursing school, but there's some things they just, it's not, page 37, chapter 2, we're going to teach you how to have a virus while caring for others. That's not a thing that happens, So you kind of take it as it comes. Even as a male nurse, kind of feel like the lady with the lamp, if you will. You're in a dark moment, and you want to bring light to others. You want to be there and bring that light to others. So having COVID, seeing the devastation that it brought to so many of our patients, and as Sierra stated earlier, the loss that we all felt, the loss that we all experienced. Another one of those blessings in it was. Excuse me, I'm gonna try not to get all emotional. I'm a big old teddy bear. That's my wife. But holding the hand of patients as they made their transition from this life into the next, and having the opportunity to pray with them and be there in their moment, to be what they needed in that moment. What a tremendous blessing that has been. Challenging, certainly, but a tremendous blessing also. What an opportunity to just show unmitigated love. So the reason I got vaccinated was because not only did I see its effects, but unfortunately, I brought it home. I tried as best I could to stay quarantined from my wife and kids. You can only stay, we live in the same house. What are you going to do? And my daughter and wife both ended up with COVID. Thankfully, both of their time with it was minimal. Their symptoms were minimal. So again, I'm counting my blessings there. When the opportunity came for me to be vaccinated, there was no hesitation. Like, this is happening. So that's why I got vaccinated. If I can avoid bringing it home to my wife and kids again, if I can avoid bringing it in to these wonderful patients, by God, that's what I'm going to do.
Thank you so much. And Katie, I'm going to come to you in a second, but this is a great opportunity for me to thank everyone's families. When we talk about healthcare heroes, I think about our loved ones. Remember when this whole pandemic started? Many people were sheltering in place at home. And I know I was the only one who was going to the building. And I remember coming back home and seeing people out in the front yard throwing the ball and stuff. And I was a little jealous, like, what the heck is going on? But I digress. The point is, our family members, the people who support care professionals, they are heroes and will always be heroes. Katie, why did you get vaccinated?
Well, like he said, it was like as soon as the vaccine came out, it wasn't a question for me because I felt like it was the first time that I had something I could do to stop the spread from it. From the beginning, I went through COVID at 2 different buildings, and the spread happened so fast once it got into the building that it felt like something we couldn't control. So as soon as the vaccine came out, I immediately jumped in and got my vaccine to be an example to our staff, to show that I was willing to do it. And me and our executive director went first to show them. But yeah, it gave us some control over it and something. And I feel like since then, we've had a lot of our staff have been vaccinated, and most of our residents, and we've already seen the difference that makes. We have had a couple positive employees since then, but it doesn't spread.
Well, I tell you, your words are so strong, and I truly hope the audience can hear. I know we're having a little bit of technical issue with the volume, but let me tell you, you mentioned you made the decision, I believe. And what I want to make sure our listeners know is that regardless of any mandate or timeline that's been placed on us, you still have a choice. And it's always going to be a choice. The reason why this is so significant for us in our industry is we care for people. And now the expectation from those that keep us regulated, and we need to have some oversight. Let's be transparent here. That's a good thing. But at the end of the day, they've made the decision that you must be vaccinated in order to work in our space. So with that, we want to get back to a choice, because even with that mandate, the decision is still yours. And we're asking everybody to prayerfully consider it, From your perspective, let's start with Katie. What keeps you up at night thinking about what could happen in regards to this vaccination situation that we have?
Well, I definitely have concern about us losing staff members and then not to care for the residents. And that is my biggest concern.
Okay. Okay. Well, you're going in and out just a little bit. So let's jump to you, Sierra. What's keeping you up at night thinking about, what could happen?
I would say my biggest fear with the COVID and the vaccine is that it's going to enter the building again. That was probably the worst experience I've ever been through. Like Jeremiah said, he was working with COVID with the residents that had COVID, and like, you felt sick yourself, but you're trying to provide this care for somebody and you're trying to do your best, but you don't feel your best. So I would say that's probably my biggest fear, is just entering the building again and spreading like wildfire as it does, and just trying to keep myself safe, my family safe, and my residents safe. So
Thank you. Jeremiah.
I'll be completely frank with you. I don't have any fears about it. Frankly, because I'm a little tired of being tired. I'm tired of being afraid. I refuse to be afraid. Now, I'll be cautious. I am gonna do everything I can to protect my patients, their families, and my family. I don't fear it any longer. The reason I don't fear it any longer, and this is just Jeremiah, I'm not being preacher guy, it's where my faith lies. So whatever happens is going to happen. I think it was the Navy SEAL Marcus Luttrell said, there's no good times or bad times, there's just the times and how well you're prepared. So for me, it's just about staying vigilant and being prepared.
Well said. Well said. So what we want to do now is just start wrapping up this brief family discussion. And let's throw it out there to the three of you. If you could summarize in 60 seconds or less, any loving parting comments as we get ready to exit from this short discussion. Let's start with Katie.
So I would just ask that you would take the time to think about it and consider why you came into the industry, why you do the difficult job we do in serving the residents that we have in our facilities. And if this is still something that you feel like is your calling, if you would really consider what a difference you can make, you do make, and will continue to make. And then just to ask the questions that you have. If you have fears, if you have concerns, talk them through with people. Go to the physicians, go to different people in your facilities and ask those questions and really consider something you could do to help us serve.
Thank you. Sierra?
I wanted to say, if you're on the fence about the decision and you do work in healthcare, it's always in the back of my mind, like, how can I help my people? And if you're in this profession in healthcare, you care. I mean, you have to care. You have to have compassion for people. And that's what made the decision easiest for me, is because I do care. And I wanted to provide that protection for everybody that I have day-to-day contact with. So, yep.
Thank you. Jeremiah? I think you're stuck, Jeremiah.
There we go. Sorry about that. So super quick. My encouragement would be, certainly to prayerfully consider getting vaccinated. The truth is we all have different motivations, perhaps why we initially entered healthcare. But the truth is we have people at their most vulnerable who have given us the immense opportunity to care for them. So for me, my impetus, as I stated earlier, was to do whatever it takes to care for them. My only regret with the vaccine is I didn't get any superpowers. I mean, I was really hoping for help me out. No superpowers, but neither here nor there. That would be my encouragement. Prayerfully consider, remember why we're here, because what we do is great. As nurses, it's easy we check the boxes, right? We fill out that Medicare documentation. We're doing a whole lot of what, but remember your why, because if we can remember our why, then the what becomes a whole lot more powerful and we become more effective at what we do.
Well, I'll tell you, I'm not going to miss this opportunity to thank you all. The reason I'm in healthcare is because of two distinct opportunities in my life. The first one was volunteering and visiting with a gentleman by the name of Mr. David for 5 years. And then the second was being sick, having over 30 hours of surgeries and 4 different hospital stays. And one night in my hospital bed, because of the way the nurse had cared for me, I made the decision that I would serve our senior communities for the second half of my career. So when we think about our clinical professionals across the globe, hospitals, senior healthcare organizations, home health, hospice, agency, everybody has this dilemma in front of them right now. And I think about the nurse who came in my room and had such an impact on my life that I changed careers while I'm in my 40s. And I think, well, what if she decides not to get vaccinated? What if she wasn't the nurse? What if she can't be the nurse for others that she was for me? And so I just want to say to all of our clinical professionals out there, your sacrifice has been tremendous. What you do each and every day is tremendous. The staffing, the way you all continue to persevere is tremendous. And I just thank you from the bottom of my heart for all of the care that you have provided for me personally, as well as for leading while I operated from the ED position. I was dependent upon you all practicing at the top of your license each and every day. So thank you all for joining the Care Network today. And we ask you if you would prayerfully consider, we have a deadline that's in front of us, and we need you. We need everybody, each and every one of you. So thank you. Thank you for joining us, panel members. I hope everyone has a great day.